what would people like to talk about? Well, packages and pricing is what the theme is tonight, but it's generally what have people got to ask or even suggest, or what have you tried, what's worked, what's not worked?
I was sort of, I had a look at Jim Pruzak's, yeah, how he was doing it.
Mm-hmm.
And he sort of organised an assessment and then did a package of 4.
Mm-hmm.
And I thought with the number of times that we often end up seeing people, that sounds like quite a good way of doing it.
Mm-hmm.
Because I think when you take on a new patient who you've already perhaps spoken to on the phone for about half an hour,
mm-hmm.
and you've got the idea that the SIRPA approach is appropriate for them, you're then sending out the forms, you're getting them to fill the forms in, you're having to spend some time reading them through before you actually even see them. So there's quite a lot involved, as far as I can see, in that very first appointment.
Absolutely, yeah.
It's almost, and I think then if they attend the appointment, they're getting a good idea, or both of you are, that there's obviously going to be quite a lot of work ahead. So I think that first appointment is quite good to be separate.
Yes.
Yeah. Because they might then decide, I'm actually not quite ready for it after all. And then there hasn't been that agreement, say, for any more, if you're going to put it into a package. So I think that first appointment being separate, and he's suggested a little bit more money for that first appointment than it would be per appointment if you did a package afterwards. Absolutely. And I think we do end up seeing them a number of times. And I think my feeling is, I don't do packages, I'm just doing them one at a time, but I do wonder whether by offering it in packages of 3 or 4 or whatever people like, I mean, as the SIRPA practitioners like, I mean, then they've committed basically to that work ahead of them, and I think that's quite a good thing to do from their point of view as well. Once they've made that decision, they're going to go ahead with it. To me, it just, they know what's expected, they know that it's going to cost a certain amount of money, they're going to have to put in the work in order to make it of value. And it means they probably will do the work as well. Yes,
and they've shown that by, if you offer things for free, people aren't necessarily going to be to work as well with that. And time and time again we've done that, and I've certainly found that if organisation have paid for their people to come and see me, they're the ones that miss appointments rather than the ones that actually pay for me. So yes, I would, and that's certainly what I used to do and did for many years until 3 years ago. Was always did the initial assessment on its own, and then did a follow-up. I did a follow-up of five appointments. Or they went off after their assessment with some advice, and they went to see how they did, and it might be that down the line they felt they needed help then. And I agree that that's nice in many ways. That's nice, and it gives them the understanding. They get to know you. They know what you can offer with. They know whether they feel that this is something they need support with. They're not tied in for too long, but they are paying for a few appointments, so they know that, like you said, it's going to take time to work through this. And like you say, paying a bit more for the first assessment, and certainly when I was doing that and then working out the cost for the programme, I was looking at what does it include. So I factored in, for example, if I was giving 5 follow-up appointments, I factored in the fact that I was offering email support. So I looked at maybe an average of, I think I included something like quarter of an hour a week for email support, knowing that some would use it a lot and some don't use it at all. And so I still now think that sort of averages out. There are some people that email me every day, but on the whole, it tends to be, maybe not every day soon after the appointment, and then it goes off a little bit.
Tails off a little bit.
But I factored in time to go. So I looked at the amount of time it took me to go through emails, to go through the pre-assessment forms, and to actually see the patient. And then I actually then factored in time to write up my notes afterwards, which was the time-consuming bit, and the bit that I really hated. had that, the nice bit of actually assessing somebody, but then actually writing the notes up. And not just writing the notes up, I, at that point, no, still wrote an email with a summary and suggestions. Now,
Yeah.
so I included all that in the time, and then I looked at how much I was going to charge per hour, that I was happy with, that I felt that it was worthwhile, and then I made sure that you know, whatever that was for that 2-hour appointment or whatever, and it used to be an hour and a half. I now do a 2-hour appointment. Now the one thing that I really did feel resentful was writing them the email afterwards. So what I've done now is I have a template. So I have a generic template where I have an email that's written out with attachments like the key skills that I send everybody to when they've had an assessment, the journaling tips, for example, although that's now in the key skills, and some links to 2 or 3 other things. And then and an email saying, it's lovely speaking to you, and you know, whatever. And then I can tweak it and add or remove rather than starting from scratch. And the other thing I make sure they have is a pen and pencil during the assessment, because what I found was that I was then sending an email after it with the summary and suggesting, you know, who it might, what they might be. It might be a good idea to journal about to begin with, for example. And actually, I'm doing that within the call now and encouraging them to have pen and paper and write those things down. And then I'm reinforcing that after the assessment with sending them the key skills and reinforcing that self-soothing is really important to learn for this stuff, to emotional stuff. So that, I think it works well doing an assessment and a few together. I now do a 3-month program, and for me that works really well for me now. Partly because the people I take on tend to have been around every single person and had loads of input, and quite often done some of the online programs with the other things work as well. And the reason I do this now over 3 months is that rather than if you've got somebody with real long-term problems, things that have been going on for a long time, and they've maybe got anxiety and depression and that sort of a lot of personality beliefs and behaviours that need working on, then in 4 or 5 treatments you've got time to educate and help them understand it. But actually, and then they often might go away. But you're not, what I find now is by giving them longer, I've got more time to go through everything, but I'm also helping support and guide as they're facing the challenges in their life. Like somebody this morning who's halfway through, who went to a funeral. He's journaled about his dad in the past, had a challenging relationship with his dad, and we've done quite a bit of work on that, but went to a wedding this weekend, and he thought consciously, yeah, I'm fine, even though my dad's going to be there, you know, I'm fine about it now. And then he had pain throughout the whole weekend. And if he had not been working with me at that time, he'd have not worked through the emotional stuff, because he's still so much in his head that he's processing, trying to work everything out, and really not yet emotionally acknowledging how he's feeling emotionally and going through all that. So the fact that I was able to today look at, okay, so what could you have done beforehand, and we'd go through that, and what could you have done at the wedding, rather than just standing there and trying to resist it and just putting up with it. What could you do? And it's that experiential side of things where people can learn to build capacity that can help in the long term. Having said that, it doesn't mean that when you've done a set of appointments you can't do another set. But it's just at the moment, this for me works well, but I wouldn't recommend that to everybody at all.
So how many times would you see them in that 3 months?
12. So they have 12 hours.
Yeah.
I see them weekly, but the first 2 hours is the assessment. And then I see them weekly. They get email support. They get access to the online program. They used to, when I started this, I thought, oh, I'll give them access to WhatsApp for urgent messages. And then I stopped that pretty quickly because that meant they got my mobile. I tried having a different mobile, didn't work because I can't cope with 2 phones. And because I work with people worldwide, it meant I was waking up in the morning to people freaking out and going, oh my God, I need help. And I go, oh, I can't cope with this when I put my phone So I don't do that now. Occasionally we'll have to do WhatsApp because they can't do Zoom or Skype on one occasion, and I make it very clear then that, you know, this is just for this call, and that I do not, you know, if you have any queries at all, please go through, you know, email me, because I will not respond to WhatsApp. That's how it goes. And that's fine.
And do people contact you sort of on the email? Are they sort of things that could wait till the appointment, or are they
could,
really
but I find it helps better because it works better because you're then helping them when it's happening, and they can process it then. And if you're leaving it a week, it means that a week later they're trying to remember what happened when the pain came on or whatever. Personally, I find it really good because it really isn't that they don't abuse it. I mean, I do have one at the moment who is the one that does email an awful lot.
Yeah.
But it's not abused. It's really about trying to work out that, you know, that my pain shot up last night. I just don't know what's going on. And I don't want them to spend a week struggling with pain that's increased because they haven't been able to themselves understand what's going on. Whereas if I can answer the questions then and there, quite often the pain resolves, and because they've been able to actually learn, and they can learn from that when they're more aware of what's happening. So that's how I work, and I feel it works well with my patients.
Yeah, I think I'd have to be a little bit careful who had access to that and who didn't, because if I was working with the trauma as well, because a lot of the people I've started seeing are, you know, have got trauma underneath the...
All of mine have trauma.
Yeah, but I'm working actually on the trauma because I'm a trauma therapist. So I'm working with the trauma and then I'm educating them on the pain.
But that's what we're doing with this work, is actually, you know, I have people coming to me with abuse from the past.
Mm-hmm.
If they need a psychotherapist, then we would have already referred them to a psychotherapist.
I'm a psychotherapist, so I am working on that.
Yes, but what I'm saying is that so am I, in that we're exploring what's happened in the past and encouraging them to journal about it. And in fact, somebody recently, I did the emotional awareness, EAT, so the emotional awareness and expression therapy I did with him because he actually came into the office. And we were dealing with an issue that had, actually was more of the ISTDP, so it was the ISTDP side of things. And I don't usually do that, especially not online. But he was sitting in here and we were working on something with an issue he had with a relationship with his stepdaughter. And then I said, well, when have you felt like that before? And it connected back to his dad. So we went back to a time when his dad was actually, had him in the corner of the room when he was 10 years old, kicking and literally kicking and jumping on top of him. And so I was leading him through that.
Yeah, but I'm talking about my patients that are personality disordered or...
That's different.
Yeah, so I would have to be careful who I gave email access to, as the point I was making.
Right.
Sort of,
if you're working with people with mental health problems rather than people with pain who have anxiety and depression, even if they've got trauma in the past, because we are working with people there's most of my patients have trauma in the past, but if you're working with people with mental health problems who also have pain, then of course you've got to be far more and set stricter boundaries. I mean, my boundaries are that I will answer their emails within work hours as well. So at least they know that I will answer, but I'm not going to be, it might be within 24 hours, for example. But yeah, absolutely. You've got to, within your own profession, be able to look at what are the boundaries that you need to be able to deal with this. And for example, someone like Michelle's a GP, it's not going to be answering emails out of hours, okay? No. Just popped into this. You want to know what we're talking about, Michelle? But,
no, I've been trying to get in for a quarter of an hour. I'm really sorry. The top link wasn't doing anything, and then I've just found another link and I've gone in that way. Sorry I'm late, everybody.
Right. No, don't worry. Yeah, and all of this, when we're talking about packages, is about fitting it to you. You know, what works for you. And there are some people who absolutely don't want to provide email support. Somebody had said that they used WhatsApp support for urgent. That's why I did it. But I very quickly thought, this is not for me. Yeah. I can't cope with people messaging me on my mobile at all hours of the day or night, because my mobile is for me personally. And for example, I had somebody who was trying to message me, a practitioner who's currently on the training at the moment, who was messaging me, but it was like Sunday night. And again, I'll ignore it because I will not, get involved unless I really want to for some reason. But generally, I have quite strict boundaries because my mobile phone, I don't have things coming to me all the time. But Facebook Messenger is something that I do because that's family and friends. And so then, but then if an out of hours one comes, if it's, most of you, then I would probably just quickly respond, all right? But if they're people I don't know, then I would leave it, wait, and then respond at another time. Because otherwise I'm just inundated all the time. But yeah, with a package, it's looking at all the different options and deciding what fits you best. You within your profession, you within the way you work, because it depends on whether you work online, whether you work face to face. That might factor in different equations as well.
I think you have to be very brave, though.
In what way?
To put a big package together, to value yourself well enough to go, yep, you're in with me.
Catherine, how long has it taken me? I mean, my work has evolved over the last 13 years, okay? I started off treating, charging, I don't know what it was now, that's about £30 for a physio session. I can't remember, £30, £35 for a physio session. And then I started taking people on for this work. And then realised that I had to charge. Well, first of all, I nearly went back into the NHS a couple of times because of all the trips over to America and all the, losing patients because they're all getting better. So I knew I had to start charging more. But this is about valuing yourself, as you said, and that was so hard. And it's easy to decide how much are we going to charge. I'm a physio. What does everybody else in the area charge? That's so easy. But then I was having to morph my work and so I started charging, I think it was £60 for an appointment for somebody for TMS. And then if I had somebody who came as a physio appointment and they were then moved to TMS, I was really struggling to actually make them, start paying more. And so I really had to work out how I was going to do this. And I very gradually increased. And in fact, I ran a course the other weekend. Judy, you were there, weren't you?
Yeah.
And I actually I can't remember whether I removed this slide or not. But I think I removed it. But it was about this doctor who came and had an assessment and 5 follow-up appointments. And he paid me £250. Okay. And the amount of time I spent with him, it was a ridiculous amount, but I didn't value myself enough at that point. But it got to the point where I realized I needed to be charging more. And what I did in the end, and I was so scared when I did this because I thought, am I going to lose patients with this? I doubled my physio rate. And I actually started charging my physio rate for £60 and thinking, well, people are just, as soon as I say it, people are going to say, oh, no, I don't want to come. And when they used to say, I mean, honestly, you can imagine just how I felt when I said, well, okay, that's fine. Yeah, I can book you in for assessment. It's £60 for the hour. And they said, yeah, okay, can you book me in? First few times it's, oh, okay. And I then moved on and increased the cost of the assessment and the follow-ups. And then it's only in the last 3 years that I moved on to do this 3-month program, and that was with the guidance of a coach, encouraging me to increase my charges again. So, we all need that support. Hi, Shaheen.
Hi, sorry. Hello, Shaheen.
Don't worry. But so it's having that guidance, isn't it, and that confidence to actually do that. But as you're getting more experience with this, then, look at, for one, you know far more than your patients know, okay? And we tend to think, well, who am I to do this? I still think that. Who am I to do this? But actually, we know so much more. Who else in your area does this work? And so it's about valuing yourself and looking at results that you're getting as well, and beginning to recognize, okay, so what do I need to be charging to be able to work in this field? Especially if you're maybe not having as many patients as you would otherwise. And we always think if you charge more, we'll get less people. That's not necessarily the case.
Georgie, out of interest, how much do you charge for your 3-month program?
For the 3-month program, I charge £1,500.
Okay.
And I have I mean, I call it a benefits rate. It's not really a benefits rate, but I do offer $1,200 if somebody's not working or struggling to get the money. And I will also occasionally do the assessment on its own. And that might be for somebody who maybe just can't afford it, or whom I feel probably just need an assessment and nothing more. In which case I would just do the assessment for $200. And that the assessment includes the 2-hour appointment, sending out the pre-assessment forms, going through the pre-assessment forms, and sending the follow-up email as well. So it's always worth remembering it's not just about the time you're spending with the patient, but actually the rest of the time that and time that you're not working as well. Sort of making sure that you are earning enough to be able to run the clinic, the office, or whatever.
And your CPD and things like that cost.
Absolutely, yeah.
Georgie, that 3-month program you just said, so how many sessions is that over the 3 months?
That's okay, 12 hours of support. I include the online program, so that's included within it. Email support throughout, and access to the Facebook group for patients.
Right, thanks.
Okay. And that was a jump for me, and I was being pushed by my coach to put it a lot more than that. And she said, "Well, you're, UK leaders, and I don't care. No, I can't do that. I'm not doing it." And I feel comfortable now. I feel comfortable with that amount, and more comfortable with knowing that there are so many more people I can refer on to as well. Okay. And I'm very choosy who I work with now. And again, that's become so much easier. One, because I can refer people on, and I don't have to say, "God, I don't like you." I can refer you on. It might be, "I don't think I'm the right person for you. I feel that you could do with some more psychotherapeutic support." I absolutely do say that at times. And if I've got enough patients with anxiety and depression, and I know Zoe says the same as well, then if we feel that, no, there's only so many you can take that really you feel that it's draining, then I will be even more picky. Okay? And so and yet that's quite hard to do at the beginning, and you feel like if you turn people down, you're not going to get enough clients. But what I found so interesting when I started letting go and referring people on and letting go of that, I need these patients, that's when more of them started coming through. And I do find that we've talked about packages and how much we charge. And the one thing that you said, Catherine, nice at the beginning, was after a 30-minute call, then you've got an understanding as to whether, they know whether they want to work with you. And that, I think, was also one of the biggest things for me that changed the game for me, was opening up this 30-minute free call. I used to always do a 15-minute call, but it was a bit of a rush and it was less automated. Now it's automated. I open up 6 half-hour slots a week, and they book online, and they're always booked up, except that I've closed them down for December. But they're always booked up, and so that's 6 a week at least. Sometimes I'll fit others in as well. So that's 24 a month. I can't take that many people on, and I only take a percentage of those on anyway, and that's nice, because then I can choose who I want to work with, and I can refer other people on to other practitioners, or just they might just need a book, and they really like the fact and appreciate the fact that I'm not trying to sell them something. I'm not trying to get them as a client. I'm always saying that this is about you making the right decision for you, and I suggest you go on the websites and look at the Find Practitioner page. And remember, there are other people that are working and work online, for example, or if there's somebody who particularly works in their area, I'll definitely refer to that person if they want face-to-face. And so that 30-minute call gives me an idea of what they're like, that gives them an idea of whether they feel they can work with me, whether I want to work with them, whether they're that sort of person that I want to take on or can take on. So, for example, if somebody with more severe mental health problems, or if they're suicidal, then I'm not going to take them on. But I know enough people now that I know I can refer on to people. Predominantly, I'll be checking members first, but otherwise, ISTDP practitioners or other people I feel that would be able to help, or depending on that person's individual circumstances. And that's a nice way to start, because you're giving, what you give out, you get back. So by just being there to offer advice, answer questions, then many of them just say, yes, but what if I want to work with you? And they literally are asking me and begging me to work with them. And actually, I'm not taking on anybody at the moment. And for the last few weeks, I've just said I've got no more capacity this year. Actually, I have, but I don't want to take them on because it's been a heavy year. And I've got this 10-day customer retreat. And so actually, it's going to be a bit of a hassle taking anybody on over these last few weeks. So I've just said I've got no capacity. So I've now got a waiting list.
I was going to say, do you operate a waiting list?
Not normally. Not normally. It usually is just about right. And it's amazing how it works. That people come into at the end of the 3-month program, and suddenly more come in.
Can I just ask briefly, how have you managed to get a portfolio of people to refer on to? Because if you were going to refer on to or recommend that they go and see somebody else, are they people you know personally through work?
Well, on the whole, obviously we've got the Find a Practitioner page. So ideally, we need to be looking at referring on. I need to be looking at referring on to people who've been through our training. If people are wanting our approach, then I would predominantly look at the SIRPA practitioners. Now, if there's somebody who's not a member but been through our training and they're living in the same town as this person, I still do recommend them because I think that's only fair to the patient. So how have I developed this portfolio? By training people, because I had nobody to refer on to at the beginning. By getting to know the ISTDP community, by now getting to know, our internal family systems and some of the practitioners that do that work. But there's somebody local to me who's a craniosacral therapist who treats children. So, and I know her well, I've known her for years. And so I would, if there's somebody locally, I would refer to her. So it's about preferably somebody and I'd say to people whether I know them or not. So in other words, if somebody wants ISTDP and they can't get to Birmingham for whatever reason, I will predominantly refer to Jess Bolton in Birmingham. She works with Angela in Canada. And there's also Ashley Francis, who works in Leicester, who does some online work. A lot of the other ISTDP practitioners are not necessarily fully aware of our work or Sano's work. And so then it's about saying to them, by all means go and look at the ISTDP website, but I can't specifically recommend somebody. But if it's Jess, I'd say absolutely, yes, I know Jess, I know people who've worked with her, I recommend her.
Are you saying ISDP?
ISTDP, Intensive Short-Term Dynamic Psychotherapy.
I thought it was sort of that. I was trying to think in my head, what do they stand for? Yeah, right.
But yeah, so
there's a register of that, is there? Right.
Well, there's a UK one, but they're not all trained by Alan Abbas, who's the Canadian specialist. But Jess Bolton, who works in Birmingham, will always chat to people as well. And she's just taken on somebody else, so she will advise if nothing else.
Yes, right.
But Angela, what's Angela's surname? Somebody tell me. Sorry?
Cooper, isn't it?
Cooper, thank you, yes. I know it well, it's just disappeared from my head. So Angela Cooper spoke at our last conference, and it was brilliant. It was so good. She's done a couple of courses for us as practitioners as well. And it very much interlinks with our work. There's a little bit about it in our training anyway.
Yes, I have come across the term.
Level and working with more people with more mental health conditions as well.
Yes, that's what I feel I'm missing, is a little link to someone like that, but I'll go and search.
Well, yeah, where are you based again, Michelle?
Isle of Wight. No, not sure.
Oh, yeah. Because sometimes I'll refer to a Havening therapist as well. If it's anybody, especially somebody who understands the way we work, our concept. So anything that might be somebody that would benefit from some TRE, so I might recommend that. But if they need support in our field, then I will always refer within our field first.
Yeah. Thank you.
Anything else on packages or pricing?
Yeah, I think one of the, I always think when I was looking at sort of, if you were doing an assessment on its own, which some people might want or need, either of those things. Obviously, if you've got a run of maybe a package of 4 or 5 treatments afterwards, to some extent, the free half-hour consultation and maybe some of the extra work that you put into the assessment, because I added that up to be about 4 hours, to be honest, in doing a half-hour consultation, sending the forms out, getting the forms in, looking through. And this might be, obviously, once you're more experienced with this, it will take quicker. But kind of looking through that stuff and then doing the assessment, whether that be an hour and a half, 2 hours, whatever, following up with I'm checking the note of what you said about the template, but emailing them. Do you phone call them as well after the appointment?
Phone call them?
Yeah, do you phone them as well after the assessment, or just send them the email out? Right?
Just send the email out and
All that
say.
into account. I think starting out is, when I think of all that, I kind of think, wow, that is going to be a lot of money for an assessment kind of thing. Whereas if obviously they're taking on a package of 4 or 5, maybe you're spreading some of the kind of cost amongst kind of those 4 or 5 assessments. So sorry, those 4 or 5 follow-ups. And I think working out what I initially thought I would, want to charge for an hour, what I then came up with for that assessment, I just thought was way too much. So I just wondered about, I'm talking about getting started. How, you've said that you raised your prices and things. Kind of what your thoughts were on, if you start and then, I don't know, I'm guessing 7-8 months down the line, you make quite an adjustment to your prices. Do you think that's, I don't know what the word is, an okay thing to do? Because I think I'm nervous about charging the amount that when I worked it out, I thought to charge for assessment initially. And of course, you want to get clients and things. Is that a reasonable?
So what was the cost? Are you happy to say what the cost was for the assessment you were thinking of?
I worked it out £145, which I just thought I'll never get any clients.
For how long?
Was it a 2 hour? It might have been for a 2 hour, just because from the work I've done in Keighley and spending an hour and a half on assessment and thinking, actually, I still need that bit of extra time to go through something maybe with them. The other argument to that is, of course, 2 hours is a flipping long time for them to sit and kind of have that amount of time. I think that was for 2 hours.
They don't have to sit all the time. They can get up and move around. How does everybody else feel about that cost?
I think it's fine.
Yeah,
I think it's good value for 2 hours.
Yes, 2 hours.
It's less than I charge, but for what I do at the moment, by the hour. And I'm not even qualified with SIRPA yet. I'm doing other stuff.
Same here. That's less than my hourly rate, and I'm not qualified with SIRPA
Liz,
yet.
you are like I am an ex-NHS physio. And that means we have spent our time not charging for anybody. And therefore, even just charging is a big thing. So I know that was what was holding me back initially, was the fact that I'm an NHS physio, not valuing myself as far as money-wise as to how much, and having to charge people. But £145 for a 2-hour assessment, and the value they'll get from that assessment, I would suggest is good. And part of this is about you and your beliefs about money as well, and your value yourself.
And if you think about it, when you're assessing, you're not only assessing, you're educating at the same time. So they're getting a bit of treatment in there as well.
Yeah, that's you're sending them information to follow up and do. So you're guiding.
I was thinking of pulling it. I was thinking, gosh, to start off, it's going to have to be under £100, and I'm thinking, gosh, that's a big drop from 145. That's a massive drop. I'm not going to be I'm not going to be making any money, but I'm not going to be making the value that that.
Yeah. And that's the mistake I made, Liz, at the beginning. So learn from mine.
Yeah, and I was advised by someone who had started up a business before I did, and they just said, you can always up a little bit more, but you can't go down. So go in at your higher price.
Yes, absolutely.
Never start too low.
And if you go up after 7 months, then most people will have already worked with you. So then, they might not come back. And if those same ones come back, then you charge them what you charge them, if you want to. That's your choice, but it doesn't mean you can't increase your costs.
Yeah, that's true.
And you don't have to blatantly put it out on the website either. I don't put my charges out on the website because, and somebody's just emailed me recently and said, could you tell me what your charges are? I don't tell them because, and I emailed back and I said, I actually don't work, on an individual one-off appointments, but I don't, I can't remember how I put it. I don't work with everybody. I'm limited into the amount of people I can work with. So I never work with anybody until I've actually spoken to them. And I offer a 3-hour call. So if you'd like to have a chat, then I'm happy to then decide what might be in your best interests, rather than just saying, because, you can imagine if I just came out and said, oh, I charge $1,500 for a 3-month program. I've never got any patients that way. So they can inquire. And then I then offer them a free half-hour call. And then they're really thankful that they get this free half-hour call with no commitment at all. And then I'm there answering questions and advising. And they then know whether they want to work with me or not. And it's their choice. And what we find that's why I asked everybody what they thought about £145 for 2 hours. Because most people here are working privately. And it's not a huge amount of money for a 2-hour appointment when they're going to get what they're going to get. And you can always give them added extras, like in my email afterwards, I give them things, okay? Because then the more you go over and beyond, the better, but it doesn't have to be time. So it could be, for example, I will share links to visualizations I've done, or an audio of something. I don't know, it could be a PDF or the key skills, for example. It took a lot of time to put together, and I update it regularly. But to them, it's like a gift. It's something additional that they receive.
And they feel you're personalising it to them, and that you're interested because you're sending these things to them that will help them.
Absolutely. So they know that you're giving them that extra time. And that you're going over and beyond. And I will always answer questions, even if they just come for an assessment. I'll always answer questions if they email afterwards and for some advice. I'm never going to just suddenly say, no, you only paid for the assessment, this is a month later. I might keep it brief, it's a long-winded one. Or if it's a long-winded one, I'll say, give them a bit of advice, but I'll say, this is actually, we benefit from a discussion about this. I'd suggest that we book in an appointment. Okay, so they don't get 2 free calls. But on rare occurrences, I might say, okay, so it might be worthwhile just booking in a one-off call to discuss this, because sometimes they'll ask the question. It's not about, okay, this is the answer. It's about, well, what did you do when this, and how did you feel about that? And therefore, it's a discussion that's needed. And I'm not going to be spending ages and ages, because it can take time writing emails. I'm not going to spend a long time replying to an email from somebody I might have just done a free call with, or something that is not easy enough to just respond in an email. And actually, it's more involved than that. Where I would suggest an appointment.
I was just going to say, for perspective as well, I had a client recently who had a steroid injection in his knee done privately, and it was a 15-minute appointment with a consultant, and he was charged £400.
Yeah. Quite.
And it didn't work.
Oh God, yes, quite. I was thinking that, Julie, actually, by thinking about, like how much consultants are, if they go and have the sort of 10-15-minute chat with the consultant, and I don't know the cost is these days, but it is high, it's huge. So £145 for a 2-hour assessment, where they will be so happy that somebody's listening to them and supporting and guiding them. That's a big part of what we're doing, is somebody finally is listening to them. And so that's worth loads.
People do open up and say things, because I've had quite a few people saying, well, I've never said this to anybody in my life.
Oh, yes, absolutely. Yeah.
Been quite something.
Yeah, they might not include it in they might not include it in the pre-assessment forms, might they? But it then comes later when they're face to face and they're more relaxed, and then they'll just say, or they'll say, I don't know if this is important, but you can update your bottom dollar. It's important.
Can I just ask, you said you do sometimes do assessments only.
Yeah.
What are the sort of clients that you anticipate it's going to be an assessment only?
Somebody who when I'm talking to them, I get an idea that they've got a clear understanding, that they've already done quite a bit, but they need some guidance. But I get I just get a gut feeling that they're not going to need 3 months for a start. Okay. And therefore, there's no way, I'm not the type of person that's going to bring them in for a 3-month program and I think they're going to get better after 1 or 2. So if I have a gut feeling they do really well from just a bit of support and guidance, then I will offer them that. Now, the type of person, it is literally just somebody where, having spoken to them for half an hour and learn what they've already been doing and recognizing they've got good understanding already, and that there's not a lot of anxiety and depression going on. Okay, so it's really more about maybe they need a bit of support about getting more of an understanding about emotional awareness and and that they're in the head a lot, and that then anxiety, as we all know, it can just fuel everything going on. So if they're a bit more straightforward, made some progress, but maybe have plateaued, that sort of person I would be offering. Or it could be somebody who really needs the 3-month program, but is just not sure yet, wants to commit but not sure. And I might then say, well, look, why don't we just do an assessment? And then if you feel you want to continue after that, then we just add that on afterwards. So I've done that a few times as well.
I suppose with 2 hours, you've got quite a lot of time. Do you to spend 2 hours on your assessment?
Yes.
And having done that 2 hours, do you feel that you will have already been through the assessment form that they filled in, and you will have picked out the most important bit that you feel is the direction for them to work in? Because
but there's often things that come up during the assessment as well. I'm trying to think, there was an example of this recently, but usually what I'm trying to do is when I'm going through the assessment, yes, I've already got you do, don't you? You get a good idea when you've looked through those pre-assessment forms. And I don't necessarily go from page 1 right through to the end, because it depends on the individual. They might suddenly come up with something and I'll just go, okay, I'll just go straight to that area. One patient, I didn't even look at the forms, and we just literally just talked, and and that for her was what she needed. But it covered everything from the pre-assessment forms, but it was just the way that it happened. It's never happened before like that, but it did on that occasion. So yeah, I think everybody's an individual, but I've got a good idea at the beginning. But quite often, I mean, for example, I remember an army guy, about 26-year-old, who flew down from Scotland, and I assessed him, and he hardly wrote anything on his forms. So I was like being a detective, but I loved this bit, the detective side, where you're trying to look for, what links and triggers there are. And he had written something a little bit about his dad, but not an awful lot. And I remember getting about 2/3 of the way through the assessment, which then was an hour and a half, and almost sort of sitting back and thinking, I have no idea what has triggered this, what is going on. And that's when I tend to listen. I'll ask questions and then I'll just listen, because usually something comes up then. But it was with him, it was like drawing teeth. It really was, the whole time, just like drawing teeth. And it was like I had an insight. And what had happened was that he had tried for the police force twice and failed to get in. And then he said to me, oh, I'm trying to get into the army, a group in the army at the moment. And that's why my back hurt, because it was in the exercise, I don't know, some sort of exercise we were doing. And I just said to him, is that the SAS? And he went, yeah. And I'm thinking, that's quite prestigious, that's quite hard to get in. So yeah, very in-depth training, but add that to the fact that he's failed to get into the police force twice. And I just said to him, so while you're training to get in the SAS, are you doing it for yourself, or are you doing it for your father, for approval from your father? And it was almost like a shadow went over his eyes, which if I had been doing this 5 years previously, I would not have been aware of. And it literally, that's all, he just sat there, and it was like a shadow, I don't know what it's not even a shadow, it was just something changed in his eyes. And he looked and he said, what is this, voodoo? Because because I said to him, that was it, what I said to him. When I'd said that, he had that look in his eye, and I just said, "What's that brought up for you?" And that's when he said, "What is this voodoo?" And it turned out that even though when we were talking about his mum and his dad and his relationship, he hadn't really said much about his dad, but his dad never showed him any approval. And he was desperately trying to get his dad's approval that, you know, he was good enough. And so therefore, if you failed the police force and he'd had an injury with failing at the police force a second time, it was just like, you know, how you just get an insight and you think, I wonder, you know, what is with it? Why is he doing this? Why does he want to be in the SAS? And it wasn't for him. It was literally for approval. So there's no one way. Every single assessment I do is different. Yes, I think I've got a good understanding at the beginning, but sometimes it's not what I think. And very often it is, but then we build on that, working through it. And I'm just trying to get more of an understanding from each individual and listening far more than I would have done 12 years ago, which of course, Tina, you will do as a mental health therapist, but as physical therapists, no, we just get in there and, you know, do the work and don't listen to them or
even when they say ow.
Yes, absolutely. Yes.
Do you have, that would be my fear, you do the whole assessment and in the end you go, no, I have no idea either. I mean, does that
it's not about finding a root cause. It's not about finding some specific thing. Okay, right. It's about having an understanding that for him I just knew there was something going on, and that's why I was specifically with him trying to do the detective work to find out. Sometimes the trigger might be so mild that they have no idea, but it's actually triggered something from their past. So this is why it's important to get an understanding of their childhood, their relationships with their mum, their dad, and you know, whatever's been going on in the past, and to get a good understanding of their personality and their, you know, beliefs, behaviours, that sort of thing. And as we're talking throughout the program, the assessment, you're beginning to get an understanding of who they are, what they're like. And very often, you know, somebody I was talking to today, there was no trauma in his childhood. I was trying to help him understand that his experience in childhood would still have impacted him, you know, now, because that affects his beliefs, his personality. The fact that you'll know this, Michelle, I didn't know this. He put down that he had snow vision is the diagnosis that he'd been given. So in other words, like not black bits, white stuff going on his eyes.
Right, that is news to me too.
But it was triggered when he took, I can't remember now what the initials were, MDMA or something.
Right.
Anyway, I had to Google it with ecstasy. So I thought I was
MDMA.
Ecstasy.
Yeah.
And he had and I was sort of explaining to him about why somebody would, at 17, use ecstasy. In that not all teenagers will use ecstasy. So it was about helping him understand that sometimes it is taking drugs as a way of actually, for once, not feeling anxious or feeling okay. And even if he had a happy childhood and good parents, doesn't mean that he hasn't actually had you know, an impact that's affecting his life. Which he's only in his mid-20s anyway. So it's there was no cause for his symptoms as such. I always say to them, I think a nice way in my 30-minute call, I always say to them, you know, when you read the books, like Sano's books, and you know that the underlying causes, there are 3 main underlying causes: childhood, lifestyle stressors, and personality, beliefs, behaviours. Which do you think are most relevant to you? Yeah. So they don't have to say to you, I've had adverse childhood experiences, I've been abused or anything. You're just asking them which are relevant. Yeah. And they will maybe say, well, I think it's a combination of them all. Or they'll say, well, I had a very happy childhood. Or they might say, yeah, I was abused or whatever. Yeah. But it's a careful way that they can actually say as little or as much as they want. Yeah. It then gives me a good idea of what where they're going with this as well.
Do you think that some people's trigger could be like the absence of something rather than an actual thing? Have you come across Jonice Webb, Dr. Jonice Webb? Jonice Webb. No. She's American. term is CEN, childhood emotional neglect.
Oh yeah.
And
Yeah.
and she always makes the point, it's not actually something that the parents did, it's what they didn't do. They didn't, they weren't aware of the child's emotional needs.
Absolutely.
They didn't facilitate emotional awareness as a child.
And think about how common that is. Think how common that is.
It is. And I mean, her books, I've got them, and I keep referring people to them, because that's, you know, if you can learn how to, you know, relate that to your situation, that's the key, you know, to then understanding where your pain comes from, you know, or your symptoms.
And I think we all do that. I think it can be really helpful to understand that.
Yeah, I didn't start a quarter past.
Can I just mute you for a moment, Michelle? Unmute you when you want. What's that?
Okay. I'm going to say goodbye, because I was supposed to start on time and finish a bit early, but I've got to get on with the children.
Okay, all right.
Thanks,
Cheerio. See you.
Bye.
Sorry, I forgot where we were.
We were just saying about emotional neglect, and you know how that does, you know, it just, when I found the book again, and I was like, oh yeah, this is exactly what is happening in a lot of these people.
I think in the majority of the cases where there's no trauma, that is happening. It happens to all of us, because you know, our parents, and probably us when we're bringing kids up, we're not aware that we needed to encourage our kids, allow our kids to cry, allow us. That's a big part of all of this.
Yeah, and you know, it says, you know, that their physical needs are met, but it's the fact that, you know, when they go to cry, they're just sort of told, oh, come on, be a big boy, or you know, just little things like that that then seep in, and they just don't then have the emotional awareness training of the child.
I shared something on the SIRPA Facebook page recently about a picture of a toddler and a picture of a teenager, and just saying, is it any wonder that teenagers withdraw and don't communicate? Because actually, when you're a toddlers misbehave, they're sent to the naughty step. They're sent away. They're isolated. So they're not actually encouraged to. I mean, hopefully, with more and more these days, people are aware of that. But they are isolated. They're sent away. They remove their connections. Whereas we should be sitting there finding out, why are you behaving this way? How are you feeling? Express the anger or whatever happens to you. So I think, you know, whatever you call it, whether you call it neglect or something that's missing, that it plays a big part in many of our patients. And I think we need to, that's one of the big parts of my assessment, is helping them understand why they are who they are based on their experiences.
A gentler way of approaching it, rather than, you know, sometimes calling it trauma and things, isn't it? It's like, you know,
for many people it's nothing to do with trauma. And I think, in fact, there was a message in one of our, was it the TMS group, where one of the guys was saying how so many people get stuck trying to find, having read Dr. Sarna's books, trying desperately to find the trauma. And often it isn't the trauma that's the issue, and they spend so much time trying to find something that they miss how something might be going on day to day and creating so much self-induced stress day to day. But I think what you're talking about there, Tina, is prevalent in this, is really important for us all to be looking with every client, and absolutely not saying trauma. So yeah, okay, and that's why whenever I talk to people, I always say, you know, it's not everybody who has pain has had trauma. This is not about trauma. It often is about stress or not getting your needs met as a child. Is how I would put it. You know? And it just depends on what experiences they had and helping them understand.
Georgie, can I just ask a quick question before we wrap up, please? How do you know how many strategies, healing strategies, to impart with, like at your initial assessment?
Well, I send the key skills, because that includes all the self-soothing stuff, and that it's in the members group, and I'm happy for you to share those.
Okay.
So that includes like the slow belly breathing, relaxation response, so the heart math breathing, the negative writing and rationalizing your thoughts, and just general understanding about journaling. And I encourage them to.
This would be sent following it. Would this be sent out to them following the assessment?
I attach it in an email that I send to people after, because everybody needs that.
Yeah.
Everybody needs to learn how to self-soothe and to become more emotionally aware. So it links to the emotional awareness blogs as well. And so those are the ones I use. And then as I'm working through with somebody, it depends on what they bring to the table each week as to what order I go through things,
Right.
or what I share with them, depending on what's happening.
Okay, that makes sense. Thank you.
Okay. Have we covered what we need to as far as packages and pricing? I think we probably have. There's not a lot more to say about that, really, is there? What do you do, Tanya? How do you work?
I just work. I do the same as I do for chiropractic, because I don't have that many clients who come to me just for SIRPA work.
Right.
So for ease of functioning my clinic,
yeah,
I tend to just do the same as I do for chiropractic.
And that's fine when you're working, using it alongside what you're doing. It's what works best for you that fits within the way you work and your profession.
Yeah.
I know we need to wrap up. I just ask other people, do lots of other people who are doing maybe SIRPA work already give their clients or sell their clients the online program? Because obviously that's a reasonable cost. And I just wondered whether, I mean, I don't know whether you know, George, I don't know whether you know. Well,
not many.
You know, because it comes through the
I do know, yes. Yeah, not many.
Not many.
No. Whereas I prefer to integrate it because I know then that they've got that for life, that they can review it, and it also means that they're learning on that as well as, I don't have to go through the details of absolutely everything because I know they've got that. So personally, I found it works well. But no, there are a few, but there's not that many who use it as well.
I think it's nice to let them know it's there. I always sort of say there is that program.
Yeah, and recognising you all have a 50% discount on online products as well. So if somebody was going to include it in the program, then they would ideally be purchasing it themselves, but charging within the package to the individual. But when they're purchasing it themselves, you're putting in their information, not yours.
So if we give it, if we get someone to sign up for it, they pay 50%, or we get
no,
they pay the full amount.
You purchase it. It would be different for you if you're not charging a package, for example. If somebody was charging a package, they could include the cost of the online program, and they would purchase it, putting in the patient's email address and name. Okay, but because it's you that's got the coupon code.
Right. Okay.
Now, at the moment, something's going through my mind about that my operations manager would be able to answer, because he's the operations manager. But you also, yes, okay, it's coming to me, because she's the one that does all this. You do get an affiliate fee. That's it. Okay. So Zoe does this. She gets people signing up to the online program, and they put in her name. So when they buy the online program, they put in her name, so she gets, I think it's a 20% affiliate fee. Is it 10%? I can't remember. So there is that way around it, so that even if you recommend it and you're not purchasing it yourself, you still get some money from an affiliate fee. So every month, Zoe gets an affiliate fee from the program that her patients buy.
Would it be okay, just thinking, I don't know, this has just come to me, so I haven't really thought it through, but at some point, would it be okay to put like a link to that course on our website, on my website?
Again,
because I'm going to do a separate page for my SIRPA work on my website, so I was going to do like some tips and things on there. And then, so
if you were going to do that, I would be suggesting that you say, there is this online program. If you're interested, do put down the name, my name. In fact, it does request it.
No, probably best to contact me, and then I could do it and make sure that they get it.
You get a bigger percentage off if you order it.
Yeah.
So, but you'd get the affiliate fee if they did it.
Yeah, that's it. Yeah, that's why it just came to me and I hadn't thought it through. Thinking it through is probably better way. Yeah.
And it's very simple to do. but it does, as long as you remember the code. And where are the coupon codes, ladies? Because so many people ask me, well, I can't remember the code. Where's the code? Where are your coupon codes if you want to buy something off the online program, off the website?
On the Facebook page.
The Facebook page.
Yes, thank you. The group, not the page, but the group, the Facebook group, in the files section, where it says something like discounts for members or something.
Yeah.
Everything is always in that members group. Yeah. Okay, Judith, are you still there?
I am, yes.
Pretty odd not seeing you. Any final questions before we finish?
Georgia,
Yeah, go on, Shane.
go on, you go. It's fine.
I was just going to say, seeing someone for an weekly, does that give them enough time to work on? It obviously does, because that's what you do. But I've sort of been leaving 2 or 3 weeks in between seeing people to give them time to work on what I've suggested.
Okay, towards the end of the program, I leave it a bit longer, so they've got a couple of weeks between. I do it weekly. And that's because I find that the results are better when I'm keeping them on track. Because they go off on track, or they go and think, well, certainly my patients do. I've had one recently who has kept cancelling. I'm too busy. I can't, sorry, I can't get back in time. So, okay, has he made much improvement? No, okay, because he's forever leaving it 2 or 3 weeks and cancelling because he's too busy and still very much in his head all the time. So that threw me then when it changed shape here, and I'm thinking, who have we lost? I'm trying to work it out. So personally, I find at the beginning seeing weekly is really important, because they'll have questions, but if they're not ones to email and ask, then they will just go into the normal patterns and they won't think it's important, whereas it could be. And whereas actually when they're getting towards the latter quarter of their sessions, then I will. Sometimes I'll do it for half an hour every week and gradually reduce them, not often, but sometimes, depends on each individual, or it might be a longer gap as you get to know. But that's my findings with the sort of patients that I have, is that it's better if I can help them keep on track. And I know when it happens, we've had a couple in these last few months who have spread it out, and I can't keep, it's very hard to support and guide when you don't know what's going on. It's a lot easier when you're up to date and you know what's going on in their life and how they're reacting to things. And when it's going on over sort of 2 or 3 weeks, I find it harder to help them. Plus, they can't remember what's been going on, and quite often they've just gone down into a spiral and not getting in touch, for example, if they're waiting for the next appointment. But those are my thoughts on it anyway.
And I find it quite hard, because you learn an awful lot about people, their whole lives, their childhood, their parents, and then 3 or 4 weeks later I'm going, golly gosh, I can't remember all the details.
Really hard. Yeah. Whereas if I see them weekly, I'm more likely to remember them.
Yes, exactly. Yeah. Okay.
And Shaheen?
Oh, Georgie, I was going to ask, because initially you were treating face-to-face, and then you made a transition to online. I think, do you do all your treatments via online now?
Most of them, 99%, yeah.
Okay, because one of my goals is to do more and more online sessions so that I can reach, obviously a wider market and go international with it eventually. I did have one chap come to me and basically was like insisting that, is there no way in which we could do face-to-face sessions? And I was like, well, no, not really, because this is what I'm doing. I'm doing online at the moment. And then he was basically going as far as suggesting that, well, I don't believe that therapy can really take place effectively over, online. And I just wonder what your views. I just wonder what your views were on this, because obviously, we know it can happen, and it is happening around the world, especially in our field.
Mm-hmm.
There's a lot of research out there that says online therapy is as good, if not better, as face-to-face.
Really, right.
Yeah, and in CBT, there is a huge body of research to say that it is just as good, and that's why the NHS are now starting to do it as well.
Oh, right.
And it's just, it's the same as being in the room with someone.
Yeah. Because I've yet to do a treatment over Zoom or Skype, so it's going to be something new to me that I'm going to have to get accustomed to and become familiar with and become comfortable with.
And just again, really, really important as far as making sure that you rule out the red flags, okay, especially mental health ones, to make sure that they're safe or they're being supported by a psychotherapist as well.
Right.
And never do telephone, okay. You need to have video. I've been people trying to twist my arm to insist that, but my video's not working, please can you do it? And I refuse.
Right.
Because there are so many cues that we're picking up on, that they're picking up on and I'm picking up on. I need to see the color in their face. I need to see whether they're going, or whatever, or sort of moving about feeling uncomfortable, which you can't do on the telephone. I'll do a free call and talk to somebody, but we're not doing emotional work on that. We're just gathering information. And it takes time. Just begin to get into it and don't expect to get it all right first of all.
Right. And is Zoom better than Skype? Is Zoom more effective and clear?
You can do it more securely. There's a secure link on Zoom. And also it's more reliable than Skype.
Okay. Right. Skype is now encoded and encrypted end to end the same, but the online therapy board, whatever they're called, now recommend Zoom as the most effective and efficient.
Yeah.
Yeah.